It's a pleasure to be here, and I thank my panelists and all of you to be here. First of all, my compliments to the organizing team for giving such an interesting topic for discussion, and I'm sure we'll enjoy this panel a lot. This topic in healthcare context is much more complex than other industries. Patients are exposed to Google searches, ChatGPT, Gemini, social media, ads, influencers, reviews, and of course WhatsApp forwards, often before they even meet the doctor. So in this environment, attention is very easy to buy, but not trust. So this panel is about understanding the new how healthcare, pharma, diagnostics, and technology platforms, for which Manish will be joining us, can build credibility, ethics, and confidence in a noisy digital-first world. So my first question is to all of you, starting with Jaydeep actually. From your perspective, what is the single biggest shift you have seen in healthcare or pharma marketing over the last few years?
Sure. So very good afternoon, everyone. The first thing which has dramatically changed in the last decade or so is the shift from the top of the funnel awareness to engaging the overall ecosystem. What I mean by this is now it's not just doctor who is the decision maker. It is now omni-channel marketing, because we see a lot of patients, caregivers, insurers, hospital playing an important role in selecting a brand. And like you rightly said, there are 700 million users in India who is using mobile phone. And we see this trend emerging now that the first opinion used to be doctor, but now it is Google. The second opinion comes from YouTube, WhatsApp, and then comes the doctor. So there's a lot of noise in the entire ecosystem, but the important element is how do we build trust is through the clinical relevance, being there for all the stakeholders. That's what matters.
Okay, so actually the next question was for you only, the same question. We would love to know from your technology point of view that what is the single biggest shift that you have seen in healthcare or pharma marketing over the last few years?
First of all, my earnest apologies to this group. I just got into a very last minute, unavoidable thing. And I underestimated Gurgaon and Delhi traffic, so my bad. And thank you for your patience. Again, it's a very important question that you ask, right? If you look at, if I were to rewind the clock, maybe 5 years back, the consumer demands towards health was very latent, right? If I were to put it, it was very reactive. That we were saying that typically people would just download an app or go to a hospital, do a teleconsult. It was just limited to that. Fast forward, of course, the positive side of the COVID, what we have witnessed, and especially when we look at from the Google's perspective as well, is the consumer demand has shifted. It has shifted to more preventative form of health, where people want to know more authoritatively in terms of, if let's say there are certain symptoms that they are going through, who are the right choice for them? Is the care available very near to them? Can the care come to their home? All these macro factors has led to a shift on the digital side of the marketing within healthcare, which was very minimal, right? I think if I were to look at it some few years back, the shift would have been 80% traditional and 20% on the digital side. But now what is happening is this is coming close to 50%, right? And I expect it to even lopside itself in maybe 2 or 3 years down the line. So what has changed, right? One is the user behavior. Second is the advent of the health tech companies that we're seeing. And when I say health tech companies, I'm talking both on the life sciences side as well as on the healthcare side. And hence, now what we see on the marketing side, I'll come from the healthcare point first, and then I'll move to the pharma side first, right? Because that's a little tricky. On the healthcare side, it's more about engaging the consumer based on the kind of commitment and the kind of connects they are making. For example, I want to know how do I stay well. Maybe somebody is a gym goer. So based on the persona, how the segments can change, do I understand my customer that well? That too still remaining in a compliant manner, because as all of us are healthcare professionals, we know that remarketing on the healthcare side is not allowed. So that entire wellness piece that has emerged has brought that marketing around keeping people well. I mean, and we can name, there are a lot of companies, Healthify Me, Fitterfly, traditional companies like Apollo 24/7, if you see, the amount of brand they have created, right? These are the classic examples. Now I'll shift to the pharma side of it, which is tricky, because that's where you have the OTC and the prescription divide, which comes, right? While the regulations allow that you can market on the OTC side, but on the other hand, what do you do for your prescription side of the drugs? And that's where I've been seeing in some of the conversations with a lot of these pharma leaders, how do they use the B2B side of the marketing here, which is about engaging with KOFs, the key opinion formers or key opinion leaders that we talk about, right? How do we reduce the dependence to market their drugs only on the medical representatives, right? So this shift is also very significant, that we are talking about building platforms which can engage both the key opinion formers as well as the pharma companies, where they can write blogs, they can engage with each other. These kind of concepts were non-existent. Slightly longer answer, but I thought it is important to create that context.
So basically, the healthcare organizations also had to change their strategies depending on the consumer, how the consumer is now behaving. Yeah, so Dr. Sunita, what is your perspective on this?
So I belong to a chain of diagnostic centers. So we are core diagnosticians, we are not allowed to market. But like Sir highlighted, Dr. Patel, it's actually patient marketing. They are our advocates. And the moment you do good to one person, it sort of snowballs. You don't really have to work on trust. And your biggest thing is your integrity. And the moment you feel this is not to be done, and you say to the patient it's not to be done, we'll refund your amount, it's your biggest advocate. So trust is something, trust is something that really needs to be worked on, because for the last decade, trust in healthcare has really gone down. And thankfully, the government now is working a lot on empowering the doctors, and post-COVID, a lot of things have changed. And patients have started giving some importance to the doctors. Otherwise, it became to a level that they would always take a second opinion, always not trust. And the first thing, it used to be not trust, and then probably. So everybody, I think everybody who belongs to healthcare, we must take a pledge to work on building trust, and it's not going to happen overnight. So I was just listening to the previous talk. It's the same thing that if you market openly, and if you just work on your highlights, it's not going to work. You have to work on every single patient, satisfy every single person, and don't run after the amount that is going to bring you. I mean, as he said, postponed gratification, it's anyway going to come around. If you run after money, it's never going to come. If you run after your quality or your ethics and your integrity, it's definitely going to come around.
So too much information also sometimes is not beneficial for the patients, you understand? So Deepali, now you've heard everyone, so what is your opinion on this?
Thank you, first of all, Ojaswini. And while they were talking, I said, in my previous role, I've looked at IVF network marketing, I've looked at hospitals marketing, and now I work with Biocon, which is, we consider ourselves to be in the biotech space, but essentially we make medicines. If I look at the changes that are happening, I think one of the most important things, and I'll take off from where you said on trust, is you have to move away from product-oriented storytelling to what the organization and the brand stands for, in terms of whether it's a purpose, whether it's the value that they're adding to the system. And trust building is not an easy task in this day and age. Gone are the days when you said, I will do the right thing by the customer, and the word of mouth will spread and the trust will get built. No longer. You have to have architects who are ensuring and looking after the aspect that the good that you're genuinely doing gets amplified in the right space in the right manner. So I think that's one change that needs to be looked at. What is the implication of that on your org structure and the way you market? The implication for that is that your corporate communications team, which used to sit separately, needs to sit together with the brand and marketing team. You cannot have two different leaders for that, because that is getting very intertwined in this new day and age. If you look at some of the Davos commentary that is happening, they're talking about a trend that world over, by the time a patient is reaching the doctor, they've done research on Gen AI, on health issues, on medicines, on molecules, on generic formulation for that, on cost of treatment, and the works. So you're dealing with a very different kind of a patient, therefore, and therefore the trust building right, at the beginning is very important. The second implication for the org structure and for your marketing organization is, are the people in your team Gen AI sensitive? I'm not saying the solutions are all already existing, but for example, I was at the booth outside on what PubLive is doing, and one is they're taking care of the data and privacy issues, compliance. Second is how they've integrated Gen AI into their offering that they have. This is the new age kind of stuff that you must all check out in terms of how you decide to, let's say, even build your websites or blogs and stuff like that. So that's a second change. The third is, you no longer only have the patients and the doctors, to consider. You can consider Gen AI to be the third person. And the fourth is regulators, governments, insurers, that ecosystem. Because it's no longer enough to have an innovative medication. It is very important that the innovative medication reaches at a certain cost to the end customer. And this whole ecosystem, therefore, needs to be influenced and spoken to. So especially if you're a biotech or a pharma company out of India, it becomes extremely important for you to ensure that you're messaging to the ecosystem. And the implication for that for marketing is consistency of your messaging, consistency of communication of your purpose, of your value, right? And I think these are the trends that I'm seeing around changes that are happening in marketing.
Great. So do you think, Dr. Deepali, that these things are actually happening right now? Are the pharmas and all of them able to overcome this issue currently, or is it still like, in the beginning stage?
I think it's a work in progress, depending on the brand and the organization that you're working for. I think in my context, I got hired completely outsider to the pharma, industry into a high core biotech organization is because you want to architect with traditional, learnings that you have on how to build brands, how to go back, and somebody who has the experience of doing performance marketing and brand building, and doing corporate communications, because you need serious architects to see how trust can be built for your brand and for what kind of, places. So if you have to have global ambitions, or even if you have Indian ambition today, the way you manage marketing is becoming extremely homogeneous. Different brands are on a different life stage of maturity in terms of their usage of data, their usage of AI, and their readiness for the new act, the Data Act that is coming. And if one message that I have for everybody sitting over here is accelerate. Because if you do not accelerate, you'll get left behind. The second message, therefore, I have is experiment. Okay? Some things you will not get right in the first shot, but you'll be in the same boat as everybody else. But hopefully you will have 7 out of 10 things going right. So experimentation is extremely important.
Thanks, Dr. Deepali. So Dr. Sunita, now I would like to ask you, for many patients, diagnostics is the first point of contact with healthcare. So how critical is trust at that point?
I think that's the most patients feared time when they reach a diagnostic center. कि पता नहीं कितने पैसे ले लेंगे, ठीक टेस्ट करेंगे कि नहीं करेंगे. Even more than when they reach the doctor, they are more scared that there are huge diagnostic centers who have invested a lot and probably we are going to take away a lot of money from them. So all the more reason every single team member down the line needs to understand the fact that you're not chasing the amount, you're just basically chasing the ethics and the correct test to be done. not only that, a progressive approach towards updating yourself with what is happening in the healthcare world is very important. Every member of your team must be updated about the newer tests available, the newer things that are coming in. Everybody must attend genuinely all the CMEs training that are going on. A certain number of trainings are mandatory for us every year. And therefore, we are able to sometimes even call back the doctor and say that we could offer you a better test, irrespective of the pricing, would be more relevant. And if it's not required, we just cancel it out and refund. So trust is one thing that's not going to be built overnight. It happens step by step, and it's going to take years to inculcate, because it's taken years to come down. So all the team members have to be having the same ethos that every person you deal with, there has to be no conflict of interest, give the right advice, and the right decision has to be made on the patient. The organization must be progressive, like I said, means must always add tests to their repertoire, constantly diversify to add on. So if the patient comes to your center and finds that this is available, that's available too, and the doctors are well versed with what's going on in the world, and I'm going to get the right advice, I don't see any reason why the trust should come down. And another thing is that a certain amount of counseling, talking to the patient, giving a few minutes in the beginning goes a long way. Because एक डरा हुआ patient when he comes, so 2 minutes if somebody just talks to him and say, I'm going to do this to you, and this is going to do this, and if you want, this is going to happen, it goes a long way. In, of course, goes without saying that you have to maintain a certain standard of work, a good quality of work, apart from balance it out with the affordability. You have to, because we have patients from all spectrum of the society, and sometimes we have to work on giving them, like Sir said, free also and discounted also. Sometimes we have to help them out if they're not able to take up a better test. And in case something has to be added or something, if you feel that has to be done extra, what we do is the stakeholders just walk off and advise them that this is advised, you can talk to your doctor and come back to us, rather than straight away saying that aap ye add karwa lo, because that leads to a lot of mistrust. So we just train our team accordingly that you suggest this, and then just leave it to empower the patient to make the decision. So that sort of helps them build the trust.
Yeah, that's an interesting perspective. So moving on to you, Manish, as we discussed earlier, that for many patients, Google is the first stop, even before they meet the doctor. So how can healthcare brands responsibly use digital platforms while countering the misinformation, which also comes with it? Because there are so many, influencers and so many people putting up data online. So how do we tackle that as healthcare brands?
Thank you again. A very, very important question. And I'm sure if some other doctors, clinicians who are sitting in the room, this is one thing that irks them a lot when people do a Google Baba research and they come as half doctors, self-diagnosing them. I've seen nothing irritates a doctor more than this, that, why are you even coming to me in the first place? So while, see, the technology has both sides. I would say it's just like it's ammunition, right? It's the way you use it, which makes it different. I think she spoke about generative AI. Again, generative AI. If let's say if I were to talk about maybe in a banking industry, what max happens if a wrong answer goes? You have a bad CSAT, you have a bad NPS, right? Customer is angry. But in healthcare, somebody might lose their life, right? So you just can't it be. There's a question that often comes to me, a lot of these kind of gatherings to me, that as a technologist and a healthcare professional, do I see the workflows becoming 100% autonomous? And my answer always remains a clear no. And that's not my organization's stand, by the way, but it's my personal stand, because this is an area where you would need that human touch, which is being there. Second point, most important point, which is about misinformation. I would go even a step ahead. There's a lot of disinformation as well, right? If you look at beyond allopathy, when you look at Ayurvedic sciences, there are a lot of positives that also emerge out of it, right? Slightly a different form of research. But then there are a lot of quacks who also come on a lot of these platforms. As cliched as it sound, I mean, cow urine was prescribed as a mode to solve for COVID, and there's a lot of momentum that happens. Unfortunate part is, large part of country is still hinterland. We still are an agrarian economy, and people are coming from that side, right? But the phones are accessible. One thing that Google has tried to do to fight this disinformation and misinformation is to bring authoritative content, which means even if you run a search today, right now on your phones, on a YouTube or your Google search, you will see something coming out from one of the trusted sources in the country, either Apollo, Manipal, people who are authoritative, people who are doctors, right? And this is a menace that technologically, human-wise, the organization fights to ensure. Because one study had revealed that 67%, whopping 67% of misinformation on web is on health. Can you imagine the magnitude of this, right? So one of the things that I always tell a lot of teams I talk about, being loud in healthcare is bad when it comes to the marketing side, right? You have to be subtle in terms of giving the right information, but giving in a manner that any user can easily understand. That's what, to me, marketing is in there, right? And as my Google's ex-chief health officer used to say, Dr. Karen DeSalvo, is that health moves at the speed of trust, right? So it's not that technologically a lot of things are not possible today. It's just that we are extra cautious to ensure till the time something is right, we don't get it out. And I'm coming specifically on the generative AI perspective. So, but then how do we do marketing, right? Or how do we actually build brands around it, right? How do we create that trust? I think the trust lies in that messaging that any organization gives, and how much walk the talk, it gives. Consumers today want to consume information in vernacular languages. They are very curious to understand, and the amount of attention is in few seconds, whether they decide whether this brand is trustworthy or not. So who wins in this value chain? The one who markets in a way that it builds a trust towards the consumer side, that my life is in safe hands. I think she gave a very brilliant example around diagnostics being the first port. That actually creates a lot of impression about the entire healthcare ecosystem, right? So that's the way. So three things. Number one is to ensure some of the big tech platforms that how misinformation doesn't reach the user. On the user side, it's important to understand, and that's where I think government is also doing a lot of information, education, communication campaigns around it. Third is on the brands themselves. As this becomes more and more complex, the health being a broken value chain, how do you give the right messaging at right time, at right place, in the language the user understands?
Okay, so this is as per the brands, like how you are talking about the brands, how they are, supposed to give out information, that we understand. But what do you think about social media? Because social media, of course, Google, I think we could be more or less talking about Meta. So how do we control the, social media people? Is there, because as of now, there are no regulations. Now anybody can say anything on social media and it can go viral. So do you think that there's a requirement now to have some sort of regulations, maybe in some, departments like healthcare, finance, so that, people are, not having wrong information all the time from random people? Do you think that?
Absolutely bang on. And I think we are slightly delayed, but we are taking those baby steps, right? If you look at the DPDP Act, which is being there right now, there are extra steps or responsibilities that are being put on a lot of the data processing agencies, right? Then Disha, once DPDP gets into motion and it becomes an act, so a lot of fine prints are being talked about. But look, let me take a step back in this, right? You can put a lot of regulations, you can put a lot of regulatory frameworks. The key is how is it applied in reality? You know, that variable just season, right? Second is that I can't control what my technology or a platform, when it is being used at the time of data being generated, right? But what can definitely be done, and I'm not talking about a specific organization, I'm talking about as a technology industry itself. Today we have artificial intelligence tool of that magnitude, which not only understands the text or the text behind, taking the keywords, it can also understand the context. So you have an option of killing a lot of this content before even it reaches its user. Of course, that can be debated on the technology prowess of the platform, whether it happens in minutes or whether it happens in hours. But you see today, I mean, if you look at just some of the culling that has been done on the YouTube itself, there's a lot of content has gone down. And I'll not be surprised that a lot of content that has gone down is pertaining to all this misinformation and disinformation in healthcare. So it's a tricky situation. I don't think a regulation can solve it alone. It's regulation plus tech intervention plus behavioral change. And that is where I am coming back to my point about responsible marketing in our sector, which means it's only as a brand, if I own a healthcare brand or I hold a life sciences or pharma brand, it's not only about what I market, but is it also educational in nature? So you are solving two purposes there, right? One, you are helping user understand what is misinformation. Second, at the same time, you're building trust without even promoting a single product. So it solves an ecosystem problem, plus it builds trust also on your brand.
Yeah, that's very interesting. So taking this same thing forward, Jaydeep, digital health platforms often build trust without physical interaction. So what are the strongest trust signals in digital health today for patients?
Sure. I think three things. The first would be definitely having validated clinical protocols, wherein we have been talking about influencers, etc. But wherever it comes from, it has to be from the doctors or protocols or guidelines directed. Second, I would say that it has to be very consistent, because we have at least seen whenever digital platforms are getting used, people behind the phone or the kind of digital interaction keep changing, and that creates a lot of mistrust. So that consistency has to be there. And third is more from a perspective of the proof of performance. Today we see a lot of testimonials coming, and it influences that way the decision making. But I think it has to be built more on larger cohorts. So it is not just one person talking about how good the product is, but it's how we can extrapolate it to a larger audience and get age-wise, geography-wise cuts, and to understand whether that really creates that kind of a decision-making impact or not. So these are the three things. And I'm sure Manish also has a lot of competition from now ChatGPT and the other. So the point is, yeah, that's the main criteria, these three, according to me.
Right. Okay, so coming to you, Deepali, pharma brands cannot market like FMCG. So in such a regulated environment, how do you build trust without appearing promotional to the patients? Because obviously if you appear promotional, then there's no trust. They feel that it's all promotional. So how do you go about that?
Thanks for that interesting question. And I completely agree with you that in the health sector, if you are too promotional, you will actually create mistrust. And I remember when we were looking at the marketing for the CK Birla hospitals, that's the first thing that I actually mandated to the team, and I said, you don't need a hoarding ever. I said, you just don't need it. There's no reason for you to ever spend on a newspaper ad or a hoarding. I said, instead, use that budget for doing something inside the hospital because, you have big hospitals, people come in there, right? So I think it's also about the signals. And the second signal that these days people are immediately mistrusting, because there's conversation around it, is usage of celebrities. People know that use of celebrity costs money, and ultimately the consumer has to pay. So I think that's another signal that the healthcare sector has to, embed it into their mind, that the traditional ways of promotion that, let's say, in FMCG sector or other sectors use is not going to, work in the pharma and the healthcare space. I think what they need to borrow from FMCG sector is that FMCG sector has always been very good at saying, here's my consumer, here's the life issues they face, these are my insights about, how they need my category, and therefore can I cater my messaging and the product and the packaging for a genuine need. I think instead of saying, I'm just another hospital or I'm just another IVF chain and copying from others, I think we must look at where we are present, doing a very good analysis of who our customers are, what the needs, they have. And I think the fourth thing, which is very different, from the FMCG sector, is that FMCG sector is still used to taking one insight and one consumer group and building content and messaging just for that consumer group. And it kind of that whole, spray and pray methodology, still works for them. That's not going to happen. I think a lot more localization will happen, for the healthcare sector. I still distinctly remember that when we used to analyze our hospitals in Calcutta versus Jaipur versus Delhi, the expectation from the doctor, the expectation of, how they look at all the diagnostic tests, of some trusting the doctors completely, some cities. Bombay does, by the way. Bombay completely trusts the doctor when a diagnostic test is given and doesn't have the level of mistrust that Delhi patient has, So when you start looking at the data is when you start also encountering what are the trust signals and how to build brands therefore very, very differently in the healthcare sector. And I would like to emphasize again that I think the content on your blogs, the content on your website, the content that you put out on what I call the editorial, the earned media side, needs to be in sync with each other and needs to be at a level where you create, higher degree of trust. And yes, I will again take a pot shot at Manish like you did. How many of you are these days checking that apart from Google, where do you get your traffic from on your websites? We've already started seeing 7 to 10%, traffic from ChatGPT. So Manish, and that trend is something that all of you should also watch for.
So one thing I want
So they do have Gemini for that.
One thing I want to definitely add is that for our sector, accreditation helps a lot in a trust. So basically, if you are accredited by national or international bodies, then patient automatically walks into your center, knowing that it's suppose an NABL lab or a CAP accredited lab. And I'm an NABL assessor myself, so I understand that your entire scope has to be accredited, not just one parameter, and then you just call yourself NABL. So patients understand that. And another thing is that when a patient comes to you and says that ye report galat thi, so you should have a complete backing of evidence-based documentation, the source data, and complete, that Kadi has to be there to be able to prove to him, one-to-one that it wasn't like that. And therefore, source documentation is very, very important. So you really need a very robust quality team to be doing it, an independence QA team to be doing that. So every report that's handed over has to have a complete audit trail. So whenever and wherever there is a, something comes up, you should be able to prove it till the end. You have to have that sort of confidence. That goes a long way in settling things.
So continuing to the same thing, Dr. Sunita, diagnostics is highly price sensitive today. So do you think that the aggressive discounting and packages that are being done, do they affect the patient's trust in the quality?
Definitely, we need to be affordable. We need to be affordable. We have to understand the needs of the patient, but not at the cost of quality. I mean, there is a certain cost involved in carrying out a test and, maintaining the team. There's no shortcut to that. And if you're going below that, if you're offering 99 tests in 200 rupees, I mean, what's happening? You can't buy a parameter in that much. Obviously, patient will start thinking twice. वो करवा भी लेंगे वहाँ से, and अगर एक चीज़ high आ जाएगी, then they will come to another lab and say, ये वाला test ज़रा repeat करना है, got it done है, वो ठीक नहीं है. So that means somewhere they're getting it done for सस्ता, but they अंदर से trust नहीं है actually. So I guess there has to be a very good.
There is a model, there's a price value equation model that you can read even in books such as the Kotler, which talks about the fact that at a certain price point, the consumer starts mistrusting the quality. So that hasn't changed whether it's healthcare or tech or FMCG.
So we are out of time, but I think I'll just take a couple of quick questions. So Jaydeep, how important, because this is a very important topic, how important is data privacy in healthcare marketing? Do Indian consumers understand its value as yet?
So I think data privacy is a hygiene currently, but it can be a differentiator going forward. It will flip. It is going to be the same way now what we see in fintech. Having said this, I think at this point of time, the adoption of data privacy is slightly uneven. It is more directed toward the urban population, which is more socially or technologically more advanced. But even the Bharat, so-called, that is where the adoption of data privacy is slightly on the lower side. When there's a breach, only then we kind of react to data privacy. But it's a very important parameter because in healthcare, it impacts significantly, be it employment, be it getting insurance, stigma, etc. But we are evolving. It is still that curve where we are gradually getting into adopting digital or data privacy. But yet, we are not there yet, partially there, but we are moving now, especially with DPDP coming in, the industry also will become more stringent and adopt to Data Privacy Act.
Right, so I think that act is going to help us more in this matter. Yeah. So one last question to you, Manish, from Google's, or if I may say Gemini's perspective, what digital signals influence the trust most? Is it reviews, content quality, credentials, or consistency of the healthcare brand?
Since there are a couple of pot shots taken on me, I'm already feeling threatened. But jokes apart, this is I think one thing which is very important, and you spoke about Gemini. The focus, at least the organization is taking at Google, is that when you see responses, we call it in technology terms called grounding, which essentially means where did the response actually came from? Is it coming from a trusted source or it has cooked it up, right? Hallucination, as you would hear everybody of this. There's a huge focus on our responsible AI, what is being done, right? Now, coming specific that how this entire search experience and everything, which is what we are seeing a shift already, moving from our traditional search methods to more generative AI search methods, it is going to be important for brands, at least what I see from, they're still, the technology is at its infancy, but it will be very important for the brands to have a 360-degree view of what is being talked about them. Pre-generative AI era, the way I would just go as a consumer to look at, okay, this particular diagnostic brand has these many stars, looks good, right? Now, it's not only about that, not the discrete stars. It's going to continuous feedback about what is being discussed in succinct manner that somebody will understand. So you'll have to review all the sentiments that are being posted, right? And I think she mentioned about the consistency of the messaging that you're doing. It will be very easy to find out whether the brands are walking the talk, because it's no longer a search query based number of links the user is going. They are getting a crisp summary about good, bad, and ugly, right? So the brands, number one, if they want to be on the top of this generative AI-based search era, the messaging has to be consistent. The trust piece which is being demonstrated need to be spoken in all the blogs and everything that they are trying to publish. Third, when they are actually reviewing the feedbacks, right, they would have to go to a lot of the finer prints, right? He mentioned about, and I think that's very important aspect what Jaydeep mentioned, right? That once we have DPDP Act in action, right, there's going to be enormous focus that will shift to something called the SDFs, significant data fiduciaries, in a simple term, who process the data, and the data fiduciaries, which means a lot of this menace will have to be curbed further. So data privacy will no longer be my responsibility in a sense, because the consumer doesn't understand, but the brands will have to take care of that, right? So in the front end, how the 360-degree messaging is consistent. At the back end, do you have the right tools and platforms in the organization who can review and can provide insight to leading indicators, not the lagging indicators? That was in the search era.
That was very, very insightful. Do we have time for the rapid fire? No. I think we can. So we will just have a quick rapid fire. You can just answer in one line each. So Dr. Sunita, starting with you, one red flag that immediately breaks patient trust.
Probably talking less to the patient and talking about the amount and coming too low on the pricing.
Okay, that's very fair. Manish, one thing healthcare brands must stop doing immediately.
Fancy messaging.
Okay. Jaydeep, one trend in healthcare marketing that is overhyped.
AI without clinical context, I think automation, if doesn't produce any outcome, is useless.
Okay, great. Deepali, one piece of advice for young healthcare marketers.
Become AI driven and AI sensitive. Learn how to have AI as your partner, otherwise you will probably either not find jobs or soon will be out of jobs.
Okay, that was fantastic. So what's clear from our discussion is that in healthcare, trust cannot be manufactured. It has to be earned and very consistently over time. In an age of noise, the brands that will stand out are the ones that invest in 4 E's: evidence, expertise, ethics, and empathy, and not just visibility. Thank you to our panelists for such an insightful perspective on this engrossing theme. If anyone has any questions, we'll be happy to take that, or we are out of time.